Hello. So breaking down when social and health becomes education case law. So this is on about when we have social care provision and needs and healthcare provision and needs, when it's classed as being in B&F rather than in the health and social care sections. So DC and DC versus Hertfordshire County Council. Therapies that teach a child or young person skills to manage anxiety, such as cognitive behavioural therapy or mindfulness, may be regarded as special educational provision. In contrast, broader psychological support aimed at addressing mental health difficulties is less likely to be considered educational, as it does not typically involve instruction or training. So what we're looking at is the things that educate and train our children, and then if it educates and trains our children, then it would be classed as Section F provision and Section B as needs, rather than being in the healthcare section. East Sussex County Council versus TW 2016. Social care provision that involves educational training may be treated as special educational provision. However, the Send Tribunal must be give clear reasons when determining how provisions should be categorised. Within an education, health and care EHC plan, in addition, Section I of an EHC plan cannot name a person's home as their educational placement. So Section I would be blank if a child is not going out to a placement and is on the Yotas package or is uneducated. And the Send Tribunal must be very clear on their reasonings when they come to decisions on how they're going to categorise whether it's education, health or social care. London Borough of Bromley versus Sendis and others, 1999. There is considerable overlap between education and non-educational therapy, and it is inappropriate to draw a rigid distinction between the two. In this case, physiotherapy, occupational therapy and speech and language therapy were all regarded as education in nature. So basically what this is saying is that there is overlap between education and non-education therapy. We can't just say there's a hard, fast rule that this is education and this is non-education therapy, because that overlap sometimes means that we need to ensure that where appropriate it is classed as educational in nature, and it is needed because it's going to be used as part of the education and training of our children and young people. London Borough of Illingdon versus AP and SP 2024. Physiotherapy and other provision that supports a child's education may constitute special educational provision, even where it also has benefits for the child's health. So there are times where provision that supports the child's education, so it might not be that the provision itself is education, but it supports the child's education, that this would be seen as special education provision, even where it's for the benefit of the child's health. London Borough of Ellenborough versus Lancashire County Council, ex parte M, 1989, and 2 FLR 279 AP and SP 2024. Speech and language therapy may be regarded as special educational provision. So if a child needs speech and language therapy and it educates or trains them and it is used to support them to access education, then it would be regarded as special education provision. Westminster City Council versus FTTA 2023. Where supported by sufficient evidence, provision delivered outside of term time that is necessary to promote a child or young person's consistent development or to support their education may be regarded as special education provision. So this is saying outside of term time, if a child still needs provision to support them and needs that consistency for their development, then it can still be regarded as special education provision even though it's not within term time.